everyone. My name is Teresa Bishara, and I'm a hospital pharmacist in Toronto. Today I'm here to talk to you about the COVID-19 vaccine. Because it's a new vaccine, there's a lot of questions out there, and it can be hard to find reliable information. So I'm here to talk to you about some facts and myths about the COVID-19 vaccine. So even if you are completely healthy, there have been lots of reports of healthy individuals who, when they do get the COVID-19 virus, have suffered long-term complications. You may have heard of the term herd immunity, and that simply means that as a majority of the population gets vaccinated, it protects people who are not allowed to take the vaccine for whatever reason. So it is a good idea, whether you think you're going to get really sick with COVID-19 or not, to consider taking the vaccine. The vaccines were developed more quickly than traditional vaccines, but there are reasons for that. First of all, because of the pandemic, there was international collaboration among scientists and governments, so they worked together to do this quickly. Second of all, there was also global funding, which really facilitated huge, well-run studies around the world. And thirdly, there was quick recruitment. Another thing to keep in mind is that mRNA vaccines are faster to manufacture than vaccines that are not mRNA vaccines. However, that doesn't mean that any safety steps were skipped. The technology behind these vaccines has been around for about 10 years, so it's not brand new. And just basically a lot of wasted time was avoided in the manufacturing of these vaccines. The COVID-19 vaccines definitely do not cause the COVID-19 virus. They do not contain the virus responsible for COVID-19. There may be some confusion if say, a person still gets the virus. It may be because they weren't completely vaccinated yet and they were exposed to the COVID-19 virus prior to them achieving immunity with the vaccine. However, it was the virus that caused those symptoms or that illness. It wouldn't have been the actual vaccine. The COVID-19 vaccine does not change your DNA or your genes. It's not capable of doing that. Both the vaccines currently approved for use in Canada are mRNA vaccines. That means that they tell your body how to make a harmless protein, which is found on the virus, but it does not contain particles of the virus. So in other words, you can think of the mRNA vaccines as a wanted poster for COVID-19. The poster itself actually disappears quickly from your body, but your body will remember what to look for if ever exposed to the real COVID virus. So there's limited data on the safety of vaccines, COVID vaccines in pregnancy. However, according to the SOGC, which is the Society of Obstetrics and Gynecologists in Canada, pregnant individuals may choose to receive the vaccine after discussing it with their healthcare provider, depending on their individual risks and benefits. We don't really know the safety of these vaccines in patients or people who are breastfeeding in terms of the effect on breast milk and the infant. However, it is not a live vaccine, so theoretically it shouldn't pose a risk to a nursing infant. And again, similar to pregnancy, it really does depend on your discussion with your healthcare provider about your individual risks of getting the virus versus the benefits of taking the vaccine. So that wraps up our session on the myths and facts around the COVID-19 vaccination. I hope you found it useful and helpful. As always, please post questions you may have and we'll try to get to them. And just realize that the information is based on whatever data is available. Of course, COVID-19 is constantly evolving and we just have to keep up with the data. Until then, keep safe.